Chapter 11 Tube Care Part 2. After the client had tolerated the weaning process, the physician ordered the removal of the endotracheal tube and will be shifted into a nasal cannula. Which of the following findings after the removal requires immediately intervention by the physician? A. Sore throat. B. Hoarseness of the voice. C. Coughing out blood. D. Neck discomfort. The correct answer is C. Coughing out blood. The nurse is assessing a client with an endotracheal tube and observes that the client can make verbal sounds. What is the most likely cause of this? A. This is a normal finding. B. There is a leak. C. There is an occlusion. D. The endotracheal tube is displaced. The correct answer is B. There is a leak. While changing the tapes on the tracheostomy tube, the client coughs and the tube is dislodged, which is the initial nursing action. A. Call a respiratory therapist to reinsert the tracheostomy. B. Cover the tracheostomy site with a sterile dressing. C. Call the physician to reinsert the tracheotomy. D. Grasp the retention sutures to spread the opening. The correct answer is D. Grasp the retention sutures to spread the opening. The nurse caring for a client with a pneumothorax and who has had a chest tube inserted notes continuous gentle bubbling in the suction control chamber. What action is most appropriate of the nurse? A. Increase the suction pressure so that the bubbling becomes vigorous. B. Do nothing since this is an expected finding. C. Immediately clamp the chest tube and notify the physician. D. Check for an leak because the bubbling should be intermittent. The correct answer is B. Do nothing since this is an expected finding. The nurse is assessing the functioning of a chest tube drainage system in a client with pneumothorax. Which of the following findings should prompt the nurse to notify the physician? A. Fluctuation of water in the tube in the water seal chamber during inhalation and exhalation. B. Drainage system maintained below the client's chest. C. Drainage amount of 100 ml in the drainage collection chamber. D. Occlusive dressing in place over the chest tube insertion site. The correct answer is C. Drainage amount of 100 ml in the drainage collection chamber. A nurse is supervising a student nurse who is performing tracheostomy care for a client. Which of the following actions by the student should the nurse intervene? A. Removing the inner cannula and cleaning using universal precaution. B. Suctioning the tracheostomy tube before performing tracheostomy care. C. Changing the old tracheostomy ties and securing the tube in place. D. Replacing the inner cannula and cleaning the site of the stoma. The correct answer is A. Removing the inner cannula and cleaning using universal precaution. The nurse is handling a client with a chest tube. Suddenly the chest drainage system is accidentally disconnected. Which is the most appropriate action for the nurse to take? A. Secure the chest tube using a tape. B. Clamp the chest tube immediately. C. Place the end of the chest tube in a container of normal sterile saline. D. Apply an occlusive dressing and notify the physician. The correct answer is C. Place the end of the chest tube in a container of normal sterile saline.